Well, welcome back to Better Living. I'm joined now by Dr. Wade Banker from Luxe Laser. We're going to talk again about spider veins and varicose veins because we've gotten some questions about that. You and I talked about it. Gosh, it's probably been a month ago maybe now that we talked about it. It's something that really bothers, I don't want to just say women. It's a lot of people, but probably primarily women are the ones that you get that really are bothered by it in their legs especially, yes?
Yes, primarily women, but a lot of men have this as well. Most of the women are just more concerned about the looks of their legs, which is why we see a lot more women than men for this. But the underlying medical conditions are equally the same.
Yes, it really can be really dangerous. You've brought some pictures with you. I want to show people because I'm a visual person. Hence the reason I'm in television, huh? And so it helps us really explain a little better, a little easier, what's going on with varicose veins and spider veins and kind of show what we mean. So let's pop this first picture up here and you can kind of explain to us what we see. This is before and after of what you can do. Now those, I'm going to guess, those are spider veins, yes?
Correct. Yes, those are spider veins on the left, and that is after laser treatment on the right. So these spider veins can be caused by a number of different reasons. It can be genetics, gravity, just over time people are on their feet a lot, or it can be from an underlying condition from venous insufficiency or reflux, which will also cause varicose veins, and the big varicose veins that you see that are very big and bulky and bulge out of the leg. This is after laser treatments. You can see that they're all gone. This is it's not painful at all. And a treatment might take, for something like that, maybe 30 minutes.
That's amazing.
The nice thing about this is this is much better than the old way of doing this, where they did the injections. Injections are simply outdated with the lasers that we have now. Injections are very painful. They cause a lot of swelling. They have to wear compression stockings for a week or more. So this laser, you come in and get it done, and you walk out just the way you came in, and you could go to the gym that night.
If I have to, okay. But it's remarkable the difference in appearance of that leg. I mean, it really, the self-confidence that would give somebody, I can only imagine.
Oh, it's amazing. I mean, you can literally watch them disappear right before your eyes while we're doing it. It's actually amazing to see.
We talked about, you mentioned the underlying medical conditions because those spider veins, they're a little bit more on the surface, but some of these can be varicose veins that really are some major issues with somebody's veins. The next picture kind of shows us maybe what some of the underlying medical conditions can be.
Yes, so here you see a normal vein has valves in it, and these are in the legs, if you can extrapolate that. And the blood flow should only go one way. It's trying to go backwards, but those valves hold it from going backwards on the left side. On this side, you see the valves are incompetent. This can be from pregnancy, maybe a little bit overweight, and simply genetics. And the valves don't close all the way, so the blood's it can go backwards and flow down to the feet, which it should never go backwards. And it pools in the bottom of the feet and it causes blood clots, can cause pulmonary emboli, and it causes those unsightly spider veins as well as the large varicose veins. So this is the condition here that usually is the culprit behind most of it.
I don't know much about medical things, but I do know that blood clots are really bad.
Yes.
So that's something that you obviously would want to get taken care of before it caused something really serious.
Yes, this is a true medical condition which insurances pay for. So this is not out of pocket for anyone other than a copay for their insurance. So insurance would usually cover this 100%. They won't cover spider veins, but those are very inexpensive to do the spider veins with the laser.
And the next picture we have actually, now this shows that, I'm guessing that's a varicose vein?
Yes.
See, look,
yes.
I feel like I'm getting like a medical degree right here, just sitting with you. Can I? Well, okay, that's a whole nother story. That is a varicose vein, and that is also from the laser treatment?
Yes.
That can make that go away?
Yes. There is, usually that is from reflux. You see those big bulging veins in the back of the calf, which is very common. Lots of people have this. They just don't know that anything can be done about it.
Right.
This is from the blood flowing backwards, and it creates all that pressure, and the blood has to find a way back to the heart. So it takes the path of least resistance, goes to the skin veins, eventually causes these big bulging veins because the veins don't have good walls, and they bulge and they protrude out of the skin, and they cause a host of different problems when it starts doing that. We simply do a vein ablation, which takes less than a half hour to do, and those will all just go away on their own.
That is remarkable. So, and like you said a minute ago, people can walk out after that.
Oh yeah, they walk out just normal activities.
Go back to work?
Go back to work. I would suggest that if we do a vein ablation that they not work out hard, vigorously for 2 days, but after that they can do whatever they want to do.
That's amazing, because I do remember years ago people having to wear the stockings, not be on their feet for 2 weeks. I mean, it was really made a difference in their lifestyle to get that done, and it sounds like it doesn't now.
It's almost archaic. With these lasers, that is, the need for that is extremely minimal.
Now, quickly, we've talked about the legs, and that does seem to be where the majority of problems are, but you can have, especially the spider veins, in other parts of your body, can't you?
Yes, you can get them on your face, in the corners of the nose, on the bridge of the nose, on the chest even. I have seen it, and we've treated a number of different places. It's a very similar type treatment. I use a little different wavelength on the face than I will on the legs, but all in all, it's very, very similar treatments with very good results.
It sounds like it would just be the smartest thing to do to come in and have it done. I have seen them on people's nose before, and it would make such a difference, especially with your self-confidence. People just need to call you to come in and get a consultation to get the process started?
Yes, they just call. We get a consultation within a few days, and get the process started right away.
Well, you should definitely do that.
With the the spring and summer is not that far off.
It's
If we're
not.
going to do this, this is the time. We've got a lot of sales, a lot of deals, so this is the time to take care of it before that spring comes and we got to put on the shorts and the skirts and things like that.
Get it done now, because not only will you look better, you will feel better, and there could be that underlying medical issue. So give Luxe Laser a call today. We'll be right back on Better Living.